Thank you very much for coming out tonight to listen to a topic that is critically important, not only to the town of East Fishkill, New York State, our country, and globally. The World Health Organization has pointed out that this particular problem, substance use disorder and mental health issues, are the single greatest problem facing our world today, and that by 2020, it will be in the top spot for the diseases that are really affecting our world. With that, I want to be able to call up the coordinator for our Southern Dutchess Community Coalition, and most of the folks that you see on our panel are in some form or fashion connected to our coalition. You're going to learn about what our coalition is. You're going to find out about some statistics. And then at the end of the evening, courtesy of Mary Richards, who's joining our panel this evening, we're going to offer a Narcan training, a community Narcan training. So with that, I'm going to ask Brenna to please come to the podium and identify who you are and what you do.
Okay, good evening, everyone. So as Elaine mentioned, I am the Southern Dutchess Community Project Coordinator. So we have a federal drug-free communities grant. It's run out of the Office of National Drug Control Policy out of the White House. And what it looks to do is afford communities all across the nation with monies for grassroots mobilization, youth initiative campaigns, and media campaigning to raise awareness around addiction and substance use disorders, and target different populations in those communities, youth, parents, families, high-risk populations, LGBTQ communities, all of the above. So what our coalition does is it looks to bring a cross-section of the community together. It follows what's called a 12-sector model. So it looks to bring representatives from education, law enforcement, the business community, youth, parents, healthcare professionals, media. What am I leaving out? Just a few. So the 12 main sectors, we want to have representatives from each around the table, because while this addiction and substance use disorder is prevalent everywhere, it affects each community differently, and every community member witnesses it and experiences it in different ways. So it's important to have all of those different perspectives around the table in order to come up with a plan to attack it most efficiently and effectively. So that is a lot of the work that the Southern Dutchess Community Coalition does. And in order to begin to understand how to go about tackling the issues specific to our community, evaluation is a big piece of that. So we have to be able to understand what substances are being used most readily in our community, which are most accessible, what's the initiation age, so when are youth really beginning to experiment with each substance, and what are the approval and disapproval perceptions among youth? What do they think their parents view use as, or what do they think their peers are doing? So what we're going to start with tonight is going over our most recent youth survey data results. We surveyed 8th, 10th, and 12th graders in, I believe, all 13 schools in Dutchess County. And we do this every 2 years. And that's one of the benefits of having the drug-free communities grant. It affords us the monies to work with an epidemiologist out of SUNY New Paltz, who puts the survey together, administers it electronically, and then collates the data for us. This year specifically, in addition to the survey itself, we were able to get a trend analysis. So looking from 2006 up until 2015, so we're able to see how those results have changed over time. So we'll end with that trend analysis once we go over some of the brief statistics of this year's survey. So what is the coalition? You handed out the sheet to everyone. So that's our current working brochure. We're waiting on the more formal version, which should be in the mail from one of our media gurus as we speak. So this is our working brochure, and it gives you a nice background of the Drug-Free Communities Grant from the federal perspective, when it was established, the act created to establish it, and what the feds kind of have in mind of how they see this program unfolding. It also gives you a more general idea of our specific mission, vision, and values for our coalition, pertinent contact information. So if you're interested or you know someone who might be interested in getting involved in our coalition in the future, feel free. You can either talk to me after or pass along the contact information listed there. Any questions on that before we move forward? No? All right, so we'll also give you some ideas on how you can specifically help, and then as Elaine mentioned, we'll close with the Narcan training. So what are some of the objectives for this evening and in general? We want to help build a broader community awareness about youth risk and protective factors, which are most prevalent in our specific community, and what has the survey shown as to what youth view as their particular protective factors, and have those improved or gotten worse over the years, and we'll take a look at that. We want to discuss implementation of community initiatives, ones that currently exist that are under the auspices of CAPE and some of the coalition work that's being done. Some implementation possibilities going forward that might not exist, but that as a community we could come together and try and formulate going forward. And we'll also make available some educational and service provider material. So services available in the area related to substance use disorder and addiction, as well as mental health services, the Dutchess County Helpline, and more national-based resources as well that are more pertinent to the federal grant. And once again, the community Narcan training. So, what do we know specifically about Dutchess County? So from 2009 to 2013, Dutchess County ranked first out of 62 counties in New York State for the highest rate of drug overdose fatalities. And that is including, counties in the city. So, the Bronx, things like that. Dutchess County was well above those numbers, which is not something that many people would think to be the case. So, why Dutchess County? A lot of it has to do with geography. So we're equidistant between Albany and New York City. Distribution points, we have the Metro North Railways, Hudson and Harlem. We have Amtrak, the Hudson River, as well as a lot of major traffic routes. So I-95 corridor, Route 22 out in Dover, more in Eastern Dutchess, has been a major point of drug trafficking as well. So our geography and our rank of fatalities, back in 2014, we were designated a high-intensity drug trafficking area as a direct result of our geographic vulnerabilities. And on the heels of that, our Southern Dutchess Community Coalition was awarded the Drug-Free Communities Grant. So a lot of the increase in drug trafficking, drug overdose fatalities is what led to our community being able to get the grant that we have currently. So there's a lot of easy access points, and what we're seeing is, a lot of people have the stereotypical drug dealer profile in their minds. And what our HIDA partners have been telling us is that couldn't be further from the truth. So what we're seeing a lot of is, your suburban white-collar, typical good parent, mom, dad, they're taking the train down to the city, they're commuting a lot, and they're getting the drugs from there and bringing it back up here. And Poughkeepsie is the main distribution site that we've noticed in our area. So the typical profile that we have no longer exists, so we have to start looking at this in a different way. So what have we learned from 2015 and 2016, the recent survey? Just some general background. In total, there were 4,536 respondents spanning grades 8, 10, and 12, 47 male, 48 female. 65% of them were white, 15% Hispanic, and 5% African American. And most respondents reside at home with the family. The good news, 87% of respondents have never used cigarettes, and nearly 3% are current users. We do know that cigarette use increases with age. 31% of current smokers report smoking 1 or more packs per day within the last month. And the predominant age of initiation is between the ages of 11 and 14. And you'll notice that 11 to 14 is the predominant age of initiation for most of the substances that we'll be talking about. So how does this relate to alcohol use? 15% of students report experimenting with alcohol and 29% report current use. The biggest issues that we see are with binge drinking, not so much with high schoolers, but with our college level. They weren't included in this survey, but some focus groups we've done in the past, binge drinking is a huge, huge issue on college campuses. So with this particular survey, 14% of students acknowledge binging on alcohol over a 2-week period. So that's a pretty high number when you think about 8th, 10th, and 12th graders are who we surveyed and the age gaps that exist there. So binge drinking is definitely a risk behavior. So the influence of alcohol. Many students are drinking at home with or without their parents' permission. So this speaks to accessibility. And accessibility for these drugs in our area specifically is one of our biggest obstacles. Not only alcohol density outlets, but the very fact that items, alcohol and cigarettes are readily accessible within the homes, which for students can lend itself to thinking, perception of approval might be higher than it actually is. So accessibility is a huge issue. Nearly 6% of seniors drove a motor vehicle while drinking in the past month. Marijuana. 30% of 12th graders report current use of marijuana. Synthetic marijuana was tried by approximately 4% of respondents. What we'll notice when we get to the trend analysis a little later on is there hasn't been a huge difference in marijuana use over the years. Some people might think that's somewhat disappointing, but when you take into consideration the national attention that it's gotten for legalization and the strong proponents that it's medically safe, it's medically relevant. The fact that our youth haven't taken to increasing their use with that suggests that some of the prevention efforts in place already have proven successful. Other drug use. Respondents report greater use of prescription opiates than heroin. 29% of respondents who ever used opioids were 10 or younger when they first used. And that statistic, although can't directly be linked to this, about a year and a half to 2 years ago, there was a law that allowed prescribers to administer to 11 to 13-year-olds opiate use, which had previously not been the case, but about a year and a half ago, that law was passed. So now 11 to 13-year-olds have, the ability to get prescribed by their medical physicians the same level potency drug that a 50 to 60-year-old could get. So we're noticing that is going to impact accessibility, availability, and use with our younger youth. Additionally, approximately 5% of students have used psychedelics and 4% have used cocaine. And what we also have learned from our HIDA counterparts is cocaine use in our area is actually noticing a slight uptick, which is interesting. So what are some of the external factors that feed into these statistics? So as students get older, more of their friends have gotten drunk and or used illegal drugs. So peer pressure is still a major risk factor for our youth. Almost half of all 8th graders knew at least one adult who had gotten drunk or high. So being able to establish healthy, productive, and good relationships with at least one or more important adults is something that is still important to our kids. And they're noticing that behavior, and they might not verbalize it to that adult, but it's impacting them. And when they see those important adults in their life engaging in this behavior, it increases that risk factor for them at an earlier age. Over 50% of 12th graders reported easy or very easy access to alcohol in their neighborhood, which we mentioned a little bit earlier. They're doing a lot of this drinking at their own homes or at their friends' homes with or without parental approval. So stepping a little further back from the specific drug statistics, a lot of these other risk behaviors will feed into the risk behavior of using substances in the future. So violence. Whether violence is predominant in schools or neighborhoods is going to make one population of youth more likely to engage in substance-related risk-taking behaviors. So 40% of respondents believe it's acceptable to fight back if someone else initiates the fight. Almost 5% claim that they have fought with the intent to harm the other party. And between 1 to 3 of respondents claim to have carried a handgun to school. So these statistics, again, they're relevant to our youth and our communities, the 13 schools in Dutchess County, 8th, 10th, and 12th graders. Depression and suicide risk. 35% of respondents report feeling depressed most days in the past year. More females and self-identified other genders reported feeling that sometimes life is not worth it. So self-esteem is a huge issue that plays into these risk behaviors. And we're noticing that as each year passes, there's a lot more pressure put on our youth, both academically, with extracurricular activities, and this generation tends to be very driven, so they have a lot of self-inflicted pressure on themselves, but also external pressure from parents, community, friends. So feeling the need to succeed and getting into that good college or getting that good grade on your SATs, while is admirable, is adding undue stress to youth that increase the risk-taking behaviors. So what are some of the protective factors? So how does family and school play into it? Students report moderately high levels of clear rules within their homes. Reports are highest among younger students. So in a lot of focus groups that we've had, and we've done a lot of school-based forums throughout Dutchess County, and one question that was actually myself and one of my colleagues at the time, we weren't prepared for the question to happen. A parent asked, so what do you think is why haven't you tried hard drugs? What was it in your house that made the difference? And we hadn't rehearsed our answer, and the one thing that we came to decide was there were rules and there were consequences for those rules, and the consequences were enforced no matter what. And what we've heard from our students, both with the quantitative data and the qualitative data in the focus groups, is they feel that they need those set of boundaries. They need to feel that their parents are their parents, and the friend part comes a little bit later. So being able to have those boundaries is very important as a protective factor. Another positive is most students feel their teacher notices when they're doing well. They feel safe at their school, and they have chances to join activities. So that connection to something outside the home or something outside themselves is going to serve as a protective factor. Extracurriculars, pro-social behavior, which is going to help decrease the risk-taking behaviors. Okay, so now we'll look at the trend analysis briefly, which looks at data from 2006 to 2015. And it's the same type of survey data that is re-administered every 2 years. So how have the sample demographics changed? Not much. They've stayed relatively even. Since 2010, the total number of students surveyed remained relatively stable. Gender divisions have remained relatively stable. And while there's a small reduction in the proportion of white students participating, there's still the majority. And the addition of the other gender in 2013 did allow 4 to 5% of students to self-report into this category. So this speaks to being able to have cultural competency when we do these surveys and in our coalition work. As our community changes, we have to be able to adapt to that in order to include all different members of our community into the work that we do. So tobacco use, what have been some of the key findings over 2006 to 2015? There's been a noticeable decline in tobacco use in Dutchess County. There's over a 50% decline in lifetime cigarette use between this time span, and the decline in recent cigarette use appears to have occurred after 2010. While smokeless tobacco use is traditionally low, it too has seen a recent decline. So this data is important to keep in mind with e-cigs and vaping. So that's one of the areas that our coalition is starting to focus on a little bit more, because as tobacco use has decreased, the industry is trying to find a new and inventive way to get the consumers that they lost to re-enter that market. And the marketing techniques they use are very much so directed to youth. They have, flavored juices for the e-cigs. The names of some of the flavors appeal to youth. So it is very youth-centered and focused. And one of the things that we look to do to see how this displays itself in our community is we just recently finished community scans with our coalition. So our members went out into the community, in, their local gas stations, supermarkets, to see where are signs displayed. Are they displayed, at eye level where youth would be at the counter? Are they displayed outside near drive-throughs? What kinds of things are displayed? So the more we can know what the kids are seeing in our community, the better we can adapt our initiatives going forward. So what are some of the prevention efforts already in place to focus on tobacco use? So through CAPE, there's a program called The Butt Stops Here. And it's a smoking cessation program, evidence-based, developed by Seton Health in Albany. It's a 7-session program, and it utilizes both nicotine replacement therapy in combination with group counseling. And the programs are held on the side and conducted by trained educators. Elaine, do you have anything you want to add about that?
No, if anyone is interested in learning more about that, you can contact our agency, and we'll be happy to put you on a list for upcoming trainings that we sponsor through CAPE.
Alcohol use. So since 2006, there has been a reduction of alcohol use, which is good news. This appears most notable between 2010 and 2012, and appears to kind of plateau over the past 4 years. And like we mentioned earlier with marijuana use, while plateau isn't necessarily something we would think to be beneficial, the fact that it isn't continuing to increase means that some of our initiatives are having an impact on our youth. Current binge drinking has shown a similar decline, most notable among 12th graders. So as we mentioned before, binge drinking being a much bigger activity that the older students like to participate in, being able to see a decline in that is very significant. So prevention efforts related to alcohol. We have a campus coalition, college consortium, and tips training. So the campus coalition is very similar to the coalition that I am the coordinator for. However, the campus coalition specifically looks to bring representatives from local colleges and also bars and taverns and taxi companies that surround that immediate area around the table to see what kind of environment the students on their campus are experiencing, creating for themselves, the faculty, the community around them, and what can be done to bring in initiatives to help increase the protective factors and decrease the risk factors. So some of the projects that have been discussed on that coalition in the past have been to try and better engage the taxi companies in that community, getting palm cards out more readily to students on campus that have taxi information. So a lot of times, if students are out late partying and they don't have a taxi number readily available, they're more likely to just think that they're okay to drive and get behind the wheel of a car. Or specific with Marist College and Vassar College, which are high-trafficked areas, the colleges have noticed not necessarily fatalities, but traffic accidents involving pedestrians. So meaning, the kids are leaving a party drunk, not noticing traffic coming both ways, walking out into the street and getting into accidents that way. College consortium, representatives from area colleges that meet on a regular basis to discuss their common challenges. So similar to the campus coalition. And then TIPS, a nationally recognized program that teaches bartenders, waitstaff, and retail vendors about legal responsibilities of selling alcohol, identifying fake IDs, and how to recognize intoxicated patrons and refuse sales when necessary. Is there anything you'd like to add about the TIPS training?
Again, if anyone is interested in that, you can contact our agency and we'll hook you up with that training.
So marijuana use. Since 2006, there has been little change, which, again, not necessarily a bad thing. The one issue with marijuana that we're starting to take a little closer look at is the switch over to synthetic. So K2, spice, substances like that, we're noticing an uptick in. And marijuana is also becoming an issue with the vape pens and e-cigs. So obviously they're not sold in retail stores, but they do have the capacity for students and youth to use them for marijuana. And synthetic marijuana use has shown a small increase over the past 2 years. So that is on the uptick. The fact that it's small is hopeful, but it's definitely something that we need to keep a look at.
How about the edibles, Brenna? I hear a lot of talk about the edibles now because obviously it's easy to use them without, you know, the smell.
It is, and the potency level is a lot stronger. And similar to the increases in fatalities we saw with the fentanyl outbreak with the heroin in our area, with edibles and marijuana, you don't always necessarily know what you're getting in them. It's not pure. The THC in any form of marijuana is significantly higher than it was in its original form in, you know, the 60s and 70s. So I don't know if you want to speak a little bit more to statistics related to that.
Well, what hospital emergency rooms are seeing across the country is that, as Brenna mentioned, let's say cookies, okay? Let's say you're baking it into a cookie. You're not going to feel an immediate response to that, and cookies are a draw, so you're going to keep eating those cookies, which means that's building up in your system, and you're not even aware of it. So those kinds of edible issues have surfaced in emergency rooms throughout the United States of America. And that's why it is really potentially harmful.
So what's being done for marijuana prevention? There are 2 programs. So substance abuse prevention skills training. It's an evidence-based training developed by SAMHSA through the Center for the Application of Prevention Technologies. The training aims to familiarize participants with evidence-based strategic prevention framework. So the strategic prevention framework is something that informs a lot of the work the coalition does, a lot of the work that CAPE does. It has a methodological approach to it. So it looks to build capacity, do assessment, what else am I missing? Application, evaluation, and the cultural competency. So if you were to look online, they have what's called sort of the SPF flower. It has all the different petals in the order that you're supposed to follow it. So it is a formula. Teen Intervene, a Hazelden program designed to provide education, support, and guidance for teens, specifically who are experiencing mild to moderate problems associated with alcohol or other drug use. So both of these programs, CAPE does offer, they continue to offer, and they're able to adapt them, not just specifically to marijuana, but to any substance use. Opiate use. So heroin use increased after 2006. However, since 2010, there's been a small decline in reported use. The total number of youth ever trying prescription pain medication without physician's approval has shown a small decline as well since 2013. However, there's been a small increase in number of youth reporting in the past month. Fewer than 4% report recent use. Opiate and other drug findings. There's been a decline in cocaine use since 2010. However, not much change noted in that between 2013 and 2015. Higher use of inhalants among younger students reported in 2006 has declined, and psychedelics show a small increase in use among 12th graders. So what's being done prevention-wise in this area? We have counselors in 4 school districts and 10 schools, so they serve as a resource for both the students, the faculty, and families. They're able to meet one-on-one or in group counseling to provide assistance for substance use disorders or whatever issue the student might bring to their attention. So they're there as a confidential resource for students and the community. Professionals Education Program, a series of substance abuse related trainings sponsored by CAPE for people working in the field of addiction. And these trainings provide a lot of acronyms you got there. KSAC, CPP, and CPS. New York State, OASAS is Office on Alcoholism and Substance Abuse Services. So these trainings provide credit hours for those programs. Recovery Coach Training. So CAPE has a new Recovery Coach program. You'll hear from one of those very recovery coaches when we get to the panel discussion shortly. Elaine, I don't know if you want to talk about the line item that specifically funded this.
Sure. About about a year ago, we were fortunate enough to receive, courtesy of Assemblyman Frank Scartatos, a wraparound, a sum of money that was dedicated to a wraparound project, and it became recovery coaching. John will give you some more specific information from the panel, but what it allows my agency to do is to take a male and a female recovery coach, folks who are in long-term sustained recovery and have evidence-based training in working one-on-one with people to help them sustain their recovery. And that has been going strong since February of this year. And again, you'll hear a little bit more about it from John, who actually serves as CAPE's male recovery coach.
We also have the Too Good for Drugs and Too Good for Violence program. This is an evidence-based program. It is K through 12, I believe, and it works on providing youth with ways to better deal with peer pressure related to drugs or peer pressure related to violence. And it also looks to engage the family in that process as well. So younger students will be sent home with homework assignments to work on with their parents to help open up that dialogue at home at an earlier age. And Narcan trainings, which a lot of you are here tonight for. We've been doing a lot of them countywide, and we'll continue to do so. So age of initiation, what you'll notice is age of initiation is almost uniform across the board for most of these substances. 11 to 14 is that key initiation age for tobacco, alcohol, marijuana, and other drugs. Alcohol begins primarily 11 to 14, cigarettes, marijuana. So all this is really indicating is age of initiation hasn't really changed over this span of years. So prevention in Dutchess County focused on younger students. The Marathon Project, it's a long-distance running program offered through CAPE. It pairs at-risk youth with mentors in Hyde Park, Poughkeepsie, and Newburgh school districts. It teaches them the nutritional and physical components of running a marathon, and it culminates in the Hartford ING relay race in October. Violence and depression key findings, less than 6% report ever carrying a handgun. There's some decline since 2013 among younger students. There's a little decline in youth reported feeling that sometimes their life has no purpose, and approximately 1/4 of youth report this since 2010. So what's being done prevention-wise? There's the Dutchess County Helpline. That number you'll notice on the resource slide, which is one of the last slides we have. There's the mobile crisis team, and there's also the renovation of the existing mental hygiene building, which is currently underway. Looking to open it as a 7-day-a-week crisis center, staffed with trained professionals to assess and triage mental health issues, substance abuse disorder being among them. Protective family key findings, the high level of negative perceptions towards cigarette use among adults has remained consistent over the past 5 years, and perceptions of disapproval of alcohol use have increased over time, while perceptions of disapproval of marijuana use have decreased. So that's an important one to keep in mind, because although the disapproval of marijuana has decreased, we still are kind of seeing that plateau among marijuana use. Efforts to increase parent and adult involvement in prevention. Teen Driving a Family Affair is a program offered through CAPE, and what it looks to do is bring our victim impact panel model, which looks at a cross-section of perspectives of victims, EMS, the legal perspective of drinking and driving fatalities or accidents in our county. And families, at the conclusion of that, families are asked to create a family policy surrounding that. Protective school key findings. Although small, there's a consistent improvement in students' perceptions of the social support of the school environment. So being able to feel safe and supported in school remains one of the major protective factors for youth. School-centered prevention. We mentioned both of these already. So the College Consortium, looking to bring together local college representatives, students, and community members. And then Project Success, which is the student assistance and prevention counseling initiative that we discussed. Protective neighborhood. Although there's generally a low level of neighborhood support, most youth report feeling safe in their neighborhoods, which is an important protective factor to keep in mind. And community coalitions. You've already heard about the Southern Dutchess Community Coalition. We have a sister coalition out in Eastern Dutchess. So while the Southern Dutchess one serves specifically Southern Dutchess, the Eastern is the northeastern tier of Dutchess County.
And there's another sister one emerging very strongly in Northern Dutchess.
So both of these coalitions are currently working to build capacity so they can apply for their own drug-free communities grant in the coming years. And just a summary of the key findings. Nearly all risk factors reported showed a decline over time. And regarding prevention factors in general, the only decline was in family disapproval of marijuana. So everything else has either remained relatively stable or increased a little bit. And this finding can be reflective of, with regards to marijuana, the nationwide trend of the legalization, which we talked about a little bit earlier, so that can inform the decrease in disapproval. And all other protective factors have shown improvement, which suggests that the prevention efforts in our county are having a potential impact on our youth and families. So now, would you like to introduce the panel, or would you like me to?
You have to return, sure.
Okay. So you click.
Okay, all right.
So seated at the table before us are folks that have been working collaboratively with our Southern Dutchess Community Coalition and CAPE. And what I'd like to do is give each of them the opportunity to briefly introduce themselves, the role that they serve within their community, not just on the coalition, and a little bit about some of the success they've had, because one of the things we learn about coalition work is celebrating your success becomes critical, particularly when facing challenges that are large, and this one certainly is. So you've heard from Brenna, so I'm going to start at the opposite end of the table. And Kevin, would you start this off?
And I'm Kevin Key from the police chief here in East Fishkill. You want me to go on to some of our programs?
Absolutely.
Some of the things that we're doing, as a member of the Community Coalition, I represent law enforcement. I throw in the law enforcement perspective on our discussions of anything that we try to do collaboratively for prevention and education. Some of the things we've done specifically here in East Fishkill, on the education side, we do sponsor the 5th grade Too Good for Drugs program here. I have an officer that goes to all 3 elementary schools here in East Fishkill and teaches every 5th grader in town the Too Good for Drugs program. A lot of people still call it DARE. DARE was the original model. And it's kind of been dissected and reworked, and the model that is slowly replacing it is the Too Good for Drugs model. It's got more evidence-based data behind it, and it shows some improved workings and showing some data that it's actually taking hold with some of the younger kids. A second thing we do is we have the drug drop-off box at the police station. We encourage people, when I speak to the seniors or I speak to groups, we try to encourage people to come in and use that. If you have outdated medication or you have family members that have old medication they no longer use, bring it down to the police station, throw it in a baggie, dispose of it in the box, and we make sure that it gets burned and destroyed with up the Dutchess County incinerator whenever we get rid of our regular evidence that goes along with it. And then we file the paperwork with DEC, and it's all properly disposed of. But it's important to get those things out of the medicine cabinets where young people won't find them. And we do know from experience, many young people that are getting their hands on drugs are getting them from home. So any chance we can get old, outdated medication out of people's houses, the better off we feel about it. And the last thing that we do is we do have an officer in the Dutchess County Drug Task Force for our enforcement end of things. Our detectives are very active in our own drug investigations, but when we have something that expands outside of our own town, we turn it over to the Drug Task Force. We have an officer there, a detective there, and they do a collaborative, organized effort against larger drug dealers and drug houses and things of that nature. So it's our three-pronged contribution to the problem here in East Fishkill and hopefully the whole Southern Dutchess area.
Thank you, Kevin. Mary is new to our panel. Mary, you want to identify what you do?
Sure. I'm Mary Richard. I'm a nurse, but I'm also a public health advisor with the Department of Community and Behavioral Health. I'm representing the medical examiner's office tonight. I work a program with Dr. Kian Newman, who oversees the Narcan program. We go do trainings. We've done all the Wappingers nurses. We've done most of the major school districts. I work one-on-one with families and people in recovery to do their Narcan trainings. What my primary role at the health department is that I relink HIV positives to care, and we've noticed an increase in our IV drug users with HIV as well as overdose. And I work specifically with youth in the health department STD clinic. So we have a lot of crossover between our IVDU, our intravenous drug users, their families, and the young children making poor choices, and we try to get them into services. We have everybody takes a 5-question surveys on interpersonal violence, on drug use and alcohol use, and then we can glean their care in our clinic from that and make referrals to the Department of Mental Hygiene should they hit those markers, and we've done very well with that. We work a lot with the what's the name of it? The team that comes in, crisis intervention team. Yeah, because a lot of our people are having problems or coming down, and they have a lot of problems with that. So we work with them, as well as the text program that mental hygiene has, where we text them. There's 24 hours. These kids are so tech savvy. There's always someone on the other end of a text line. And we get calls from them that they want to come in and be screened, either through dating violence, abuse, or poor decision-making at the time. I also push what's called PrEP and PEP. PEP is post-exposure prophylaxis. So if someone has made a risky decision or a non-decision, if it's a violent, say a sexual assault, we can get them into treatment right away so that they don't catch HIV and other STDs. And we also have PrEP, which is pre-exposure, which is people who have high-risk behaviors or are part of a high-risk behavior. We get them in treatment where they take one pill every day, and it reduces their transmission of HIV by up to 70%. So we're very busy.
And we're very grateful you joined us tonight,
thank
Mary.
you. It was fun.
John?
Hi, I'm John Cassidy. I'm a recovery coach for CAPE, which is a contract for Dutchess County. My job, I'm the male version. Megan is the female. A lot of our calls come from family members of people struggling with substance use disorder, parents, sons of, and they call. And essentially we set up a meeting and try to devise a plan with them that works for them to get them into the multiple pathways of recovery. The specialized thing about the recovery coaches, I'm a person, and Megan is as well, with lived experience. So the KSACs and the other clinical try to diagnose and try to fix problems, and they're also they're tied through paper on how they behave. We're kind of unlimited at this point. New York State's recognized the epidemic and is saying, hey, let's send people out who are qualified through lived experience. You know, it's an amazing program where we do forums all over the county. I have about 25 guys in my caseload right now. One really brief, cool story is I have a guy who graduated law school, got into opiates off of an injury, been kind of slipping and sliding. I've been meeting with him since I started in March. And he's now signed up for his PrEP bar exam. He's in the 12-step recovery program. Like, things are really shaping up for him. For my job is, as a person in recovery, is amazing because I get to see stories like this. And there's 2 other guys in their early 20s who I'm starting to notice kind of a pattern of trying to find a position. They got in a little bit of trouble when they were younger. Now they have no opportunity at a career. So a lot of my thing is, hey, let's positive behaviors, or you're into a 12-step recovery group, but now we have to make choices to make your life better, you know, fill your time up. One guy's got a 4-year-old daughter. So we really just try to cradle them and set them up, obviously, with recovery, but also effective ways to make their life fulfilling in the future.
You heard John mention multiple pathways to recovery. The beauty of the program that John and Megan drive is that we don't have any predisposed way that we think we need to act with any of the folks that John or Megan hook up with. We meet them where they are. We find out what their readiness is to attempt to sustain their recovery, and then help them navigate systems to gather the tools to sustain their recovery. So CAPE is in a unique situation in that we're sort of the two bookmarks on either end of treatment. We are prevention, because clearly substance use disorder and addiction are preventable diseases. Treatment is often necessary, obviously, once the disease presents itself, but you can recover from it. And there is a notion out there that because of the relapse that we hear attached to the stories of addiction, that relapse is only a part of addiction. But if you look at the medical model in other diseases, relapse is present in other chronic diseases as well. So we have to change our thinking about this particular problem and begin a conversation around language that supports prevention and supports recovery, largely because we live in a society that stigmatizes this disease. And that has to change, and that's one of the initiatives of the coalition. Nori.
Hi, I'm Nori Riley, and I raised 2 children in the Wappinger Central School District. I have worked for the Wappinger Central School District since 1996, and I've been in administration since 2006. And I think the driving force is the reduction of stigma and the realization that denial and the hiding of the disease of addiction within families has hit a critical mass. I turned to Elaine specifically, and then through CAPE to help brainstorm and to work with families. Because when I come to work with a family in an administrative role, a lot of times a wall goes up. So my primary focus is working with families and getting them on the same page and getting them open to the possibility of the disease model, and that there is hope and recovery possible. So in that capacity, I am on the board of directors at CAPE. I am vice president on that board and serve also on the coalition. We're trying to be creative in how we reduce stigma. We've developed the forget-me-not symbol, and we're trying to market that and working with people in the area. Unfortunately, you know, I remember saying to Elaine a week or 2 ago, I feel like we're on the brink of something and we're turning, and I am still hopeful, but I did get a call today that there was an overdose last night. We lost another young, I think East Fishkill resident, and so this is not going away anytime soon, and the sooner we can have an open, honest dialogue, the better in the healing process for all of us.
Thank you, Nori. So look around the room. This isn't standing room only by any stretch of the imagination. Yet New York State and the nation have designated the problem that we're talking about as a public health epidemic. So the stigma that Nori referred to and I referred to is probably the first barrier to be able to peel that onion back and make people speak in similar kinds of language about the disease model and how it applies to addiction. We cannot continue to demonize folks who we know full well are wrestling with a disease, yet our society looks badly on them. No one gets up in the morning and says, I want to have a career of being addicted to drugs or alcohol. It just doesn't happen. So the old notion of character flaw, moral failing has to be dispelled. So Bryn, can you talk a little bit about some of the creative things that the coalition has been doing to specifically target our youth, the media component?
Elaine, can I just interrupt for 1
Sure.
minute? I just want to build on what Nori said. In the last 5 days, we've actually lost 2 East Fishkill residents to drug overdoses in their 20s, 2 20-something-year-old men in 5 days. So when Elaine says it's an epidemic, she's not kidding. It's it's serious. And I get a phone call every time one happens, so I'm getting way too many phone calls. So,
And you saw that statistic that Brenna made reference to in one of the initial slides. And again, we're not reporting this information, to frighten people. But if you do not have the information at your disposal to know what you're facing, then individuals, families, and communities can't change. They can't step up the way they're going to address the problem. And as Brenna pointed out, we are doing that in small steps, but we need to enlarge that conversation. Brenna?
So some of the media campaigning we've been doing, one of the first ones we rolled out was, I believe, a little over a year ago. And how many people here are familiar with Snapchat, or at least have heard about it? Yeah? Okay. So it is a very popular social media platform among our youth. And one of the biggest draws to it is the fact that when you take a picture on it and you send it to your contacts, you quote unquote have control over how long the picture stays in existence. So there's a little timer on it. And once that timer runs out, supposedly the picture disappears forever. Now, we know the internet and media doesn't work that way. Our youth are not so believing of that. However, what we wanted to try and do was mirror that instantaneous disappearance of an image with the instantaneous hazard of making a decision. In the sense that you think, oh, well, I'm only going to try it once. This isn't going to happen to me. When in reality, it can absolutely happen to you. So what we did was we got the help of some local high school students over in the Beacon School District. We worked with Toolbelt Media, a local media boutique who was able to film television commercials for us. We were able to get a couple national TV spots. And the look of the commercial itself had the Snapchat-style vignette on it in an effort to sort of speak the language of youth and put it in terms that they might be able to better relate to. So it had the little recording button, it had the little countdown timer, but behind the screen were youth being interviewed about how they felt about the epidemic in their community. Did they know anyone that was lost to a heroin overdose? Have they themselves experimented? How has that impacted their lives? So we wanted to try and put the face of our own youth to this epidemic because a lot of times we try and sort of remove the two, as has been a result of the stigma still attached to it. One of the other big projects we're working on is releasing a documentary specific to addiction and substance use disorder as it presents itself in Dutchess County. That documentary is being filmed and edited by a local film student who also sits in our coalition.
Who graduated from John Jay High School.
She is a John Jay grad, yes. So we're excited to be able to release that. It interviews law enforcement, Dutchess County officials, prevention, treatment, recovery, the whole gambit to get all different ideas and perspectives on how this epidemic is presenting in our community.
So everything you're hearing about has some terminology to it. It's called environmental practices, and actually environmental initiatives that can help change conversations within communities. The other thing I'd like to talk about, and Kevin, jump in with anything I might say. There are two age groups in our county that are being most adversely affected, in particular by the heroin issue. The 18 to 25-year-old population, and you just heard Kevin's statistic, and also those who are edging towards Seniorville. Actually, they're edging out the 18 to 25-year-old population. And I guess as a point of reference, what we need to make clear is, and I think Kevin alluded to this, the challenges that we're facing right now are the result of prescription drug abuse. Prescription drugs, OxyContin, Vicodin, Percocet, are for all intents and purposes heroin. They are the synthetic version of heroin. And what happened from roughly 1999 up until about 2012, the market was flooded with these drugs, and they were accessible through people's medicine cabinets. And over time, everybody knew about that, particularly our younger population. They are highly addictive, even though the pharmaceutical industry initially did not promote them to physicians as such. So while we may want to point a finger at physicians who overprescribe, keep in mind those physicians were educated, or I should say not educated, in the potency of those drugs. As a result, Attorney General Schneiderman recently settled with a large pharmaceutical company, particularly the one who makes OxyContin, they settled out of court because a court case would be too expensive, but there are a whole list of marching orders that that pharmaceutical company now has to abide by. The biggest one being that they cannot send their marketing and sales reps out into doctors' offices without educational materials that are going to be vetted by the public health department. So with the pushback on that and with the iStop, Kevin, you want to just give a thumbnail sketch of iStop?
iStop basically is a computer-based program where it helps prevent what we call doctor shopping. We have people that, and I see that we've seen this in all age groups, because as you get older, you get injuries, you get surgeries, you end up taking prescription painkillers, and I've actually seen some older people that were doing this. They get so addicted on the prescription that one day they're calling the ambulance to go to Vassar. Oh, my back hurts. They get a prescription. Then 2 days later, they're going to St. Francis. Well, it used to be St. Francis. Same thing. Oh, my back hurts. They get a prescription. Then if you're a veteran, you're going over to Castle Point. And what's happening is these people are stockpiling up these pills. Well, now with iStop, it's all computer aided. So now a doctor punches your name in there and he says, whoa, wait a minute, you were just at Vassar yesterday. I'm not giving you anything more. So it's cutting back on that illicitly obtaining the medication. But the backlash to that is people in those positions then fall back on heroin because it's generally the same thing and it's cheaper, and but once they hit the heroin, it's much more, hazardous. So, but iStop, that's one of the backlashes to iStop. We're trying to cut down on the prescription abuse, but it's pushing that category of people towards heroin. So, hopefully, it's going to be get worse before it gets better situation. I'm hoping we're at the peak and it's getting better, but that remains to be seen.
So if you're interested in finding out how New York State politicians they actually voted last year and this year with a whole host of legislation to address the issues that we're talking about tonight. So if you go to Governor Cuomo's website, New York State website, you can find out what those are. Insurance is one of them. One of the biggest barriers was people thought they had insurance that would completely cover them for this disease, and it was not happening. So there was a commission assigned to take a look at the insurance and to be able to work with our government to have that insurance changed. So 2 groups in our community that are most adversely affected by it. However, there is spillover with this, and I know I was talking to Mary earlier. There are other populations with risk factors that almost go hand in hand with this substance abuse problem. Our social services have recently pointed out in a conference that they held at Westchester Medical that our foster care numbers are going off the charts, because the parents of young people are falling prey to this disease. And so it is effectively impacting every single corner of our community, our state, and our nation. And with that, I'd like to ask, I know you're all sitting here waiting for the Narcan training. I want to be able to have you have the liberty of asking any of our panelists any questions that you might like, anything that is of particular concern to you. If we have an answer, we'll certainly provide it, and if not, we'll find one for you. Any brave soul?
Thank you. I'd heard multiple explanations of this, so I'd like, somebody who is really knowledgeable. What exactly is a DAB? I hear the kids using that terminology, and being a teacher, obviously, I like to be up on exactly what it is they're talking about.
But we're going to refer that to the youngest person in the room.
It is a form of marijuana concentrate. And John, pipe in if you want to at all. I'm not sure if maybe you've seen it in any of your, no? Okay. So it's a form of marijuana concentrate. And what they look to do is extract just the pure THC from the marijuana itself, and it turns it into a liquid form. And there's a lot of different terminology associated with dabbing. So you're all familiar with, the stereotypical 420 and how that's come to represent, National Marijuana Day. What we're starting to see is 7/10, so July 10th. So when you flip that and reverse it, it spells out oil, which is the common reference to marijuana concentrate. So anything dab related or oil related is still a form of marijuana. It's just very potent because it's the pure THC form.
You're going to see the 710 T-shirts. You're going to see the Got Dab instead of Got Milk. I would send people down to Nori and make them take it off if I were you. But,
Well, my son's in college, and he said that there isn't the typical marijuana smell associated with it, so a lot of college kids do this. They do it right in the dorm room because, no one's aware of the fact they're doing this. But he also said it's like really concentrated, so once you start doing that, you don't want to go back to smoking regular pot or whatever because you're not getting as high. So
Exactly.
my concern as a parent, what are you looking for if you suspect that your kids are doing this?
What should,
The same
How is
symptoms.
it, how is it done? It's something obviously that could be done in a dorm room, so do you know the process that these kids would be doing?
It is, you can. So you can vape marijuana concentrates. So, in e-cigs, vapes, it can go in bongs as well. I believe, I'm not 100% sure on how, there is another mechanism with which they do it, and I believe nails or paper clips are involved. But I'm not 100% sure on that exact administration of it. However, I do know that one of the common symbols is a T-shirt that says "Nailed It." So that is also a reference to marijuana concentrates and dabbing and things of that
you
nature.
go on YouTube, there's a whole host of things on how to make it. It shows you where the nail comes in. You heat the nail up or something and use it to withdraw the...
Yeah.
our coalition had to have an interesting tutorial about, when was it, in June at your last meeting, maybe?
Yeah, in preparation for our community scans, because while marijuana obviously is not openly sold yet in New York State,
Legally?
there is a lot of apparel and jargon associated with it. So you could even go into our local mall, into Hot Topic, PacSun, any of those. And some of the apparel in there is not as innocent as, parents or things like that may think. There's not just with marijuana either, with some of the psychedelics. If you see sweatshirts or T-shirts with cats on it that have really big eyes, that is not just someone that likes cats. It is a drug reference. So there's a lot that our youth know that their parents and neighbors don't know. So it's almost as if they have their own language, and we had to go through that training, so when we're out in the community, we know what to look for.
So those of us on the coalition who are begrudgingly over 30 had our eyes opened quite a lot. It was more than interesting. Thank you for the question, Patty. Anybody else? Okay, with that, is there anything in conclusion that any of the panel members would like to offer that we perhaps overlooked? I think we covered quite a bit, and I know folks are anxious to get the Narcan training.
Quick, just statistically, our police department since February 2015 so far has done 15 Narcan saves in East Fishkill. And that's not to count the ones that the rescue squad may have done without us, but police officers alone have done up to 15 saves. So it's certainly something you'd want to have in this day and age. So I applaud you guys for coming in and doing it.